It's time for my IC shift recap, so let's recap my busy shift. Also, I am sitting in my work parking lot and it is blinding. I was charged this shift and I got report and then went around and said hi to everyone and checked my cajillion emails because I haven't worked in a while. Right off the bat, a nurse called me and we needed to flip the rotoprone patient. So I went and assisted with that and just kind of helped get things situated. Did a central line dressing, helped do some wound care and just kind of, you know, get the patient situated. Had to get some people cleaned up, and then a nurse called and needed help with a dilaudid syringe. So I went and helped with that. Then I had to bring the bladder scanner to another unit, and then another nurse needed the cooling machine to set up for TTM, which is targeted temperature management. So I went and helped out with that. We were getting a new admission, so I took report on that new admission, and then later on we had a code blue that I went and assisted with. When I got back from the code, I broke our secretary for lunch and then I quickly grabbed food and like scarfed it down because we were getting a new admission. And then ultimately, I ended up taking that admission over because we needed to start that patient on CRT and staffing and blah, 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 blah. I had to take that patient. And then I was busy the rest of the day with that patient because we had to move them over to a different ICU bed, had to quad concentrate all of the drips, antibiotics, labeled things. I was so busy. Luckily, I had another nurse that was there and helping me out. So, like, when I'm saying I'm doing all this, truly, she was helping me so much. Had to call and get some consent and also hang some blood products. So, I did that, checked the patient's blood sugar, and ultimately, we ended up putting them on an insulin drip. So, had to get that situated. The lines team came to place like a central line and dialysis line and all the things. After the lines were placed, I stopped the blood and quickly got all my lines cleared for use so that way I could prime my CRT and get that up and running. Had to switch the meds over to the central line because I had been running them through different lines, and then gave some patients some of their oral meds, well, through their feeding tube, and started CRT. Turned my patient, did some oral care, another blood sugar check, had some more labs, had to replace some electrolytes, give them some meds, and then, of course, another blood sugar check because when you're on an insulin drip, you are typically Q1 hour blood sugars. My patient needed some pain meds, and then they needed some more meds. And then I had to call a doctor to get some new orders and get things situated for night shift. Checked a blood sugar at 1900, gave report, and then I was piecing out of there. So overall, it was a good shift. It was just really, really busy, especially the second half. I was like running my little butt off, but we are back for shift two today. So stay tuned for my next ICU shift recap.